absolutely. So I've been a speech language pathologist for over 12 years, and what attracted me to your company was the fact that it was virtual. Traditionally, like 10, 12 years ago when I went to school, it wasn't something that we were so much prepared for. We're typically prepared for either the hospital setting, the medical setting, or like the school setting. So the fact that we now have the option of teletherapy, that definitely would probably be the primary feature factor that drew me to. I did my research because you're right. They've been growing. The number of teletherapy companies for sure have increased, especially post COVID. But I liked what I saw as far as like the reviews. So as far as like the expectations, the caseload and timing and direct versus non-direct therapy, just making accommodations for that. Because again, you've done the role. You know exactly what it means to be a therapist. And so I feel like that really was definitely a major draw.
Yeah.
I'm like, all right, thank you for letting me know. I understand that, a 4 year old's life can be very, very busy. um, but just really wanting to highlight the importance of, hey, going back to the parent concerns, like, why did we originally even like reach out for therapy? You expressed like you had these concerns, and we just want to let you know that the results do show that yes, your hunches were correct, and your kiddo does qualify for treatment. And based on the results, we know from the data, from the research, use all my evidence data to support why we are strongly recommending twice per week, and how it could affect progress, and how it can affect just child's ability to um, not fall behind, but really maintain like age appropriate skills. Because we're talking about receptive expressive skills. That's a pretty big deal, because it's not just their ability to communicate, but primarily, which is really even more important in my view, the receptive language piece. So just kind of like letting them know, hey, this is pretty serious. Like, yes, we understand that their lives can be busy, but just again using research, using data, using evidence-based practice, validating the parents' concerns, like supporting whatever documentation we've probably gotten from like the referral, like from the doctors, like, hey, we strongly recommend, and can we probably find like a sweet spot? Maybe we do like the first 3 months, we do twice a week, and the last 3 months we can probably kind of like stop, kind of evaluate, hey, this is how much progress we've made, and probably again just like we really want to continue with the two times per week. He's done so great. So just kind of like checking in. But yeah, again, just validating their concerns, showing them the data, and just like, why we want to work with you, but here it's really important.
Yeah, yeah.
So typically there's definitely some type of checklist that I'm going by. I'm not just kind of like shooting the breeze or making stuff up. I really do have to have some measurement in place. So it's not always standardized. Yes, I have done non-standardized assessment. So again, preparation, just making sure that I'm looking at all the areas that are of concern. So is it a pragmatics? Then I'm doing, I have my checklists. I have my rating scales. Typically for pragmatics, I do want to have multi perspectives. So probably have like the teacher's perspective, get the teacher to give us, hey, when Johnny's at school, kind of rate based on your observation. Then parents' perspective, here, parents, when he's at the home environment, how are you seeing him perform? So really getting that, the multiple perspectives from the different settings that he's at, different caregivers. Here, grandma, when he's at grandparents' house, like have them. So not just relying solely on what I'm seeing in that like brief 60-minute window, but getting input from other caregivers and other professionals that he may interact with on a regular basis, and taking all that information together, collating all the data, looking at it, identifying patterns, recognizing themes, and from there coming up with what I'd consider some pretty strong goals, because we have a lot of data that we're working with.
Yeah, awesome.
I guess honestly, again, I guess personality wise, change to me is the only constant. Like the only constant is change. And I think just kind of like being in the medical field, we are gonna have like changes coming down like through insurance, through that pipeline, like on a constant, like through administration. Like there's just constantly changes that are happening. So it is kind of like, I feel part and parcel of the profession is just here. We're doing this way. Oh, next week. Oh no, we're not doing that way. Oh, we're gonna switch to this assessment tool. We're gonna need that. So I think again, being in the profession, being a professional, being in the profession for as long as I have, like I've come become very like used to expecting change. You know what I mean? Like here, this week we're changing things up. Now they expect this. Now we want this. Whoever they are, but whatever it is, like it's like oh okay, just have somebody again, kind of like train, show you how to do it. Just make sure that there's appropriate training. I feel like change coming, change management can be interesting. It's always good to kind of get some heads up. We don't always have that luxury, but once we're like trained properly, because I think my biggest issue or where I lack confidence is where I don't feel like I have like the education that I need to feel empowered and feel confident that okay, I can kind of do it. But again, I feel like again, being a medical professional, it's just something that I've come to expect really. And then with technology constantly evolving, like that's also a thing. You know what I mean? So
yeah, yeah.
Code. We need that code. We're not using that code anymore. We're switching to this code. We're not using that. We're doing this instead. Oh, we need this instead, and it needs to have this. I need to 50 more things. Like, okay, all right.
Yeah.
All right. Management has changed. All right. So one company has bought out another. So we're no longer logging in this way. We're no longer doing timesheets this way. We're doing. So it may not necessarily be like therapy related, but it's usually like the admin stuff. It's usually like that type of stuff that's constantly changing from my experience. I'm just like, oh, okay. So again, just have like this is how we do it. Ask a coworker. Hey, how are you doing it? Did you figure it out? I'm really quick to ask for help. Quick to ask for, or did you hear the message? Or going back to the DOR, or going back to the director, or going back to the supervisor. All right, how are we doing this? Am I doing it correctly? And just kind of going from there. So just to be clear on the question, how do I handle like longer hours? You said versus like quiet. Yeah, so I think again, we have schedules. All the practices or schools, whatever setting we're in, we have a schedule, and so our schedule pretty much isn't new. It's not like something that's like pops up. I typically know what type of day I'm gonna have based on what my schedule says. So I don't know. Okay, between say 10 and 12, like I need to make sure that I drink whatever I need to drink before I get on, or grab my water, or make sure that I go to the potty or whatever before, and just kind of prepare, right? So yeah, essentially what I'm saying is when I know I have like a full burst of like maybe 6 patients back to back, which is very normal, just kind of making sure, okay, I have my hydration, I have my tools, I have my materials, prep. So I prepare for that. And then on slower times, it's like, okay, breathe. I know when I have my windows, I can catch up on finishing up documentation. I'm able to probably maybe organize something that I probably just, wasn't able to tend to. Tools, materials, close stuff out, group things, create folders. So just prepare. Outcomes from my career. Outcomes from my career. I think I just do, professionally, want to know that I did all the things that I set out to do as a therapist. Foundationally, at the core for me is being able to help others, and just knowing that I was able to do that. That's a big like sense of accomplishment for me. It was very important for me to also work in the different settings that I've set out to work in, and so yeah, that for me I think is the outcome. Just making sure that I was able to do all the things that I wanted to do in the way that I wanted to do it, and not experience burnout, because that's also something that I'm just like, yeah, I think I've done my dues. I think I've put in my time. The schools need the SOPs, and I love that the special ed department has a place for us there, but I do think it needs some like real, like restructuring, honestly. And until that happens, unfortunately, you know what I mean? And who's going to bring about the change? Hopefully the SOPs. Hopefully we'll all just kind of like come together like, look, this isn't sustainable. And it really isn't, you know what I mean? I feel like there are a lot of like school positions and job postings that are being thrown around and that are just having difficulty filling. So, all right, let's figure out why. Let's answer that question. So it's been a wide range again. So I worked in the prison system. I've worked as in the schools as a contractor. I've worked in like an actual clinic setting, seeing patients. I've also done teletherapy. So I've really been able to do with it whatever I've liked. Yeah. So
and so I have a question.
No, not at all. Before I became like an independent practitioner, like on my own, like I was always a part of a team, always a part of a larger organization. So that's no problem at all, because that's my foundation. That's kind of like where I started. Look at the information, right? So look at like the case history, look at their concerns, look at their goals, Yeah, so start there, kind of get a picture of my client and what is going on. And I feel like I've been saying this like forever, but yeah, it's just a preparation. Like I can't go into a session without knowing at least some idea. It's like doing a chart review, in a medical setting. It's like everywhere. Like it's like everywhere. You just always have to read. Yeah, you have to read about what whatever it is that I'm gonna get into. But I feel it's great because as parents, they're adults. I'm adults, so we have a certain expectation as far as like cognitively, like you'll be able to attend and converse and understand. But I'll make sure that I'm, connect with them in a way where I'm using terms and terminology that isn't like very speechy or scientific, but really like using layman terms just to make sure that I'm expressing whatever is going on clearly and in a way that they can understand. I'm a parent, so that's kind of like I feel kind of gives me a bit of an edge, honestly, because I get it. As a parent, I understand that you want the best for your children, typically. And if anything, I think once I became a mother, my therapy skills really like I don't know, I guess I became a more confident therapist because
Yeah.
I could understand like, like your parent like driving you across town to come meet with a therapist for 30
Yeah.
minutes most of the times. It's because they had a vested interest and like they wanted the best for their kiddo, and I don't take that lightly. So I think being a parent also helps, just my clinical skills in general, my therapy skills. But I think it also makes it easy for me to relate to other parents because I get it. I'm a parent. So yeah, so preparing, knowing what's going on, listening, and then communicating in a way that is simple and easy to understand.